know what, Reena? I want to know that what was the genesis of a little dream? What offshooted that idea to you that you took it to this level of going? What were you doing with the little dream? How did it get conceived in your head? You said while you were small in Calcutta, also you were doing it in Mumbai over the weekends. But what shifted in Bangalore that you decided to take it full length, full scale? Where did it start and how did it grow? You told us about the volunteers who joined in, but what was your purpose behind starting a little dream? Yes, the landmark course, and then you put out this project and you said 35 kids, but what were you planning to do with those 35?
Okay. So good question. I think I missed that point out. Now
Yeah.
let me come back to it. So the first thing was when I started a little dream, it started with the art camps. Okay. Um, I am an artist. I work on acrylics, oils. So art is an expression. Okay. And as I said, I was, I was with these orphanages and these, I was going and observing. So I realized food, shelter, clothing, education, the basics were taken care of. But there was a layer there, a softer layer where no one was talking to them. Okay. You when we come from privileged backgrounds, in our privileged backgrounds, someone comes and hey, what do you want to do in life? What will you become? How do you see yourself 2 3 years? There's nobody there. Okay. Either they are children from single parents or parents who are not there and left there. And so there was, if in a place there are 40 45 kids, you can't they are taking care of their food, shelter, clothing. You can't expect that dialogue to happen. And people were coming, giving them food, going away. So but no one was sitting and giving time to them. There I devised a program which was called the art camp. And in these art camps, what we did, we gave them these art kits, gave them paper, and then we went through the whole process of what is a dream. So I asked them, when do you dream? They said at night. I said, what rubbish? I dream in the morning. She says, what did you dream of? I said, I dream of swimming. I dream of, expressing myself like a fairy, like a bird. So, I was giving them cue words and trying to explain that you can dream the impossible. Because dreaming to them, and you won't believe me, Rashmi, when I was handing over those papers, it was someone drawing a stick like a teacher. They hadn't thought of anything which was unconventional. Dreams are supposed to be put in boxes. Okay. They had to be, and those who couldn't draw, we sat with them on a one-to-one. So that was a mentoring program we did. We sat with the kid. He wasn't able to draw. So he stood like, I still remember, he started blank, no expression. And blank and no expression is something which is accepted there. They have gone through hell. Some are from streets, some are from left in stations. They accept that. So from that blank expression, breaking that barrier, breaking that ice, and sitting and having conversation, simple conversation, you start drawing, and then he looks at you, he observes you, takes the paper and pencil and starts scribbling. And I still remember that one kid drew a king. Now, I want to be a king is an expression. Whichever way it has impacted him, but it did. And we allowed that dream, saying that you can be a king. The other kid, I still remember, do a Ganesha. To him, he looks at Ganesha as being, what he's seen is that Ganesha is getting what he wants, the food. And I asked him, why Ganesha? He gets food, usko to khana milta hai. No one, he just sits there. No one. So these were expressions that were happening. And we were doing these mentoring one-to-one programs with these kind of art camps. Art camp was a day-long camp. And it took a lot of energy from the volunteers. So if you had 60 kids at one go, we were taking 250 kids, which meant that many volunteers, which meant that much space, which meant that much of funds happening. So all that, so we started small, 30, 60, 250 at one place. What we were doing, that we were going to places beyond Bangalore in Karnataka, And I still remember there was a place in near Chikmagalur village where we got the entire place to ourselves. And there they called three or four government schools together, and they allowed us those government, they allowed us to have. Now, those are the things that we started doing. So the art camp was the genesis of A Little Dream. We started with art camps. So that was one program that we had. The second program that we were doing was based on hospitals. Now, another thing that in hospitals, there were NGOs that were working on, like cancer hospitals, they were giving them nutrition, food. But again, there was a softer layer when a thalassemia kid, okay, comes from Tamil Nadu, comes from other states. He's there and he has blood transfusion happening day in and day out for those many days. His parents are exhausted. There's nothing that we went and started having programs there. We started having storytelling sessions, walking inside the hospital beds. We started having clowns walking in, having conversations. We started having toy programs, handing over toys. We did the most unconventional stuff. I still tell you a story at Indira Gandhi Hospital. There was this kid, and I don't know, Rashmi, I'm going to get a little sentimental on it. His name was Karthik. Okay. A kid from one of the villages nearby. His mom and dad sitting there. And I'm doing this program all around, giving kids. He looks at me and he smiles. And he's smiling away, smiling. So I go and have a conversation with him. So I ask him that, what do you want? Just out of the blue. And he tells me JCB. I don't know, JCB. He wanted that toy called the JCB because outside the window he could see a guy, that machine tilling. Now I said, yes, done. I spoke to the parents and found out when is his next session of coming and doing they come for a period of time, they do the blood transfusion and they go. I give him the JCB. I bring it, and it's like said, I'll make it happen. And I did make it happen. I gave him a JCB. And that's where his parents told me, the doctors have said we don't know how long he'll live. It could be days or it could be a few months. That's when. Then to say that his birthday is in the next 3 days. I was like, we got special permission, and on that floor, we celebrated his birthday. And you won't believe me, when we went there back, he was with those tubes. Still have that photo, and he was with us trying to smile and cut a cake. My hubby went wrong, and it made it with whatever constrictions we had. We put balloons and all that. We took photographs of it, and in the next 20 days he passed. He passed away. Now, what we had is his memories. I made A4 size photographs of him with his parents, with his little sister, and handed it over to the parents. Now, what did we do? We created those memories for that kid. What did we do? We gave him a beautiful birthday, a birthday cake cut, which he hadn't done before. So these were stories, little stories that we were building, even in those cancer hospitals. When you see a kid has to go through the trials and tribulations, it's horrific to see. An adult is there, and then you see that, and you sit with the kid, and you play a musical item with him. He wants to sing but cannot sing, so you sing it for him. These are little things we try to do. So I remember volunteers becoming characters out of Disneyland, wearing those and going and mingling with those kids. So that was hospital has been another beautiful program. Wherever we've got permission, we've worked with the doctors, and we aspire to do much more in hospitals. That's one place. Wherever we get the permission, we go. Diabetes is another kid. HIV is another place that we've worked. So these are hospitals. That's another big program that we run in these hospitals. Of course, permission is a big thing. So we are trying to break barriers in various hospitals. The other thing that we do is dental. Dental is a program. dental is an expensive thing. Okay. So going to a GP, a general physician, is an easier thing. Bukharua. But this is, until it is really bad, these kids do not go, especially in slums and in orphanages also. So we had a group of dentists who joined me, a collaborative program with dentists, where we walked into a slum or an orphanage. And I still remember we handing over the dental kits. Then we make them open it. And then we talk, we ask them to name the brush as a friend. So we asked him, Iska naam kya hai? He says, Polly, Molu, whatever. Now Molu is going over white track, a white track, and we make them count their teeth. And then we tell them how to brush their teeth. What is dental hygiene? Brushing teeth in the night is not heard of. The toothpaste are expensive. So, they don't get it. So we help them. We take dental hygiene in a fun way, explain to them what is dental hygiene, why it should be done, a storytelling method of putting dental hygiene, and putting rhymes. We've used rhymes to explain dental hygiene. That was the fun part of it. So, dental, we've done a lot of dental checkups, and so dentists have been a core of a group of dentists have come together and done dental programs with us. That's another program we did.